Whether you currently have wrinkles, are trying to prevent wrinkles, or interested in wrinkle reduction altogether, you've likely heard of Botox and similar products like Dysport and Xeomin. Today we're talking everything Botox and neuromodulators. We'll talk everything and more, like what is Botox, how does it work, who's the ideal candidate, what are the common areas we treat, how much does it cost, what is the procedure like, what's the aftercare like, what are the alternatives to Botox, and what happens if Botox doesn't work for you anymore. What is Botox? Botox is purified from the Clostridium botulinum bacteria, and it is known as a neuromodulator. Neuro meaning neuron, and modulator meaning changing or modulating that neuron. When we think of Botox, that is a brand, much like Kleenex is a brand. How does it work? So let's use your forehead muscle as an example. You try to raise your brow, the neuron stimulates that muscle, and then it causes contraction of that, and then that results in a wrinkle. Now let's say you inject Botox that temporarily stops the neuron from being able to stimulate that muscle, so the muscle then relaxes. Around the crow's feet, you can see after you've injected Botox, then the muscle is very relaxed, decreasing the amount of wrinkles in the area. As you can see, when we're injecting Botox, we're completely bypassing the skin altogether, going right into the muscle to relax it. Who is the ideal candidate? The ideal candidate depends on the type of wrinkles you have. So when we are young, we have what are called dynamic wrinkles, meaning at rest, your forehead is smooth, but you raise your eyebrows and then you get lines there. Over many years of doing these motions, then the lines become basically permanent. We call those static wrinkles. Basically, the best time to get Botox is right at the beginning of when you're getting static wrinkles. So if your forehead is completely at rest and you still have lines there, then that's a good time to consider getting Botox. There's also preventative Botox that you get when you're younger, when you're still in the dynamic wrinkle phase. That's a different subject for a different time. But for now, a good candidate is when you're just starting to get static wrinkles. Now, what are the common treatment areas? Common treatment areas are the forehead, brows, that's usually between 10 and 25, and the crow's feet tends to be between 5 and 15 units per side, so 10 to 30 total. For Botox, you basically pay either by unit or by the area. If you're paying by the unit, here in the US, it's usually between $10 to $20 per unit, so you can see the average range in prices, and Botox is typically done every 3 months. And onto the procedure itself. If you're coming in to get Botox for the first time, often you'll have a consult with your provider, and he or she will talk to you about your treatment goals, what areas you want to treat, and go over all the good stuff. Then, if you want to go ahead with the treatment, we'll usually mark you the areas we want to inject, and then we'll go ahead and do the injections. And pro tip, if you take zinc about 3 or 4 days before your Botox procedure, you can get it to last up to 30% longer. What is it like after the procedure? After the procedure, you may have some bruising, you may have a headache that night, you can take Tylenol if you do, and overall just the rest of the day, take it easy. I'm always shocked by the patients who I inject Botox and then they ask, can I go on a 10-mile run tonight? And don't do that, just take it easy that night. And it does take about 10 days to see the full result, so give it some time. Next, Botox alternatives. What can you get other than Botox? There's a few different neuromodulators you can get. They all have the same core toxin, but they differ in the proteins that surround that core. First, the one, the only Botox. This is the original. It's the most well-known. It has an extensive research history and a long track record. It has big complexing proteins surrounding it, and this can cause antibody formation, meaning that your body's immune system recognizes those big proteins and it tries to attack them, and in the process the Botox doesn't work anymore. Next is Dysport. As you can see, these proteins are all different sizes. It matters in the fact that they're smaller proteins and it can spread more within the skin. We say Dysport diffuses, meaning that it's great for diffuse wrinkles and a very natural result. Botox results are more precise when they're injected into the muscle. Next is Xeomin. Xeomin has no proteins at all. It is just pure neurotoxin, and there's a lower risk of developing antibodies with this type of neurotoxin, and it's better if you have sensitive skin. And next is Jeuveau. Jeuveau is relatively new. It's very similar to Botox. In fact, there was a long legal battle between the Jeuveau and Botox companies. Jeuveau is targeted towards a younger demographic, and the proteins on Jeuveau are very small and uniform, and it leads to a quicker onset rather than the Botox. And the last one is Daxxify. Daxxify is really unique because the Daxxify has a positive charge, the neuron has a negative charge, so it's drawn into the neuron and it has longer lasting results. And lastly, Botox Resistance. You can become resistant to Botox if you get a lot of units or if you get master Botox. Typically, that can be a lot of units if you're getting a lot of Botox for headaches over the years, or if you get Botox under the armpits for sweating. Typically, that uses about 100 units. So, if you get these large injections of Botox, your immune system is more likely to recognize the Botox proteins and form antibodies to it. So if you find that your Botox is not working as well as it used to, or it's not lasting as long, you could be developing some form of Botox resistance. If this happens, all is not lost. You can try another neuromodulator. The most common one we try is Xeomin because it doesn't have any of those proteins, so it's more likely to work, but sometimes there's some trial and error involved. If you'd like to learn more, please subscribe or go to noteddermatology.com.